Folks, Dr. Ed Beyer here today. We're going to be talking about how the practice of yoga can help with digestive dysfunction. Okay, now my patients come to me and they always, I have practiced functional medicine for chronic illness, and one of the first areas of the body or illnesses we have to fix is digestive dysfunction, because if the gut isn't working well, we don't absorb nutrients and the body's going to be inflamed and we're not able to eliminate toxins. So digestive dysfunction is always the first thing on the list to improve when people come to me, no matter what their illness is. And I'm going to be talking about how yoga absolutely improves digestive dysfunction. So this video is for people who have been diagnosed with any type of IBS, irritable bowel syndrome, Crohn's disease, ulcerative colitis, or if you just got digestive symptoms, constipation, diarrhea. I mean, people always have motility problems, acid reflux, GERD, if you're taking Nexium, Prilosec, or proton pump inhibitors, abdominal pain and gas, or you're fatigued because when the gut doesn't work well, we don't absorb our nutrients. Even if we're taking them, we're not absorbing them into the body. So fatigue is a very common consequence of digestive dysfunction. Now, what yoga does, and I'm going to explain how it exactly does this in a minute, what it actually does is it improves areas of our brain, which is called our autonomic nervous system. Now, the autonomic function is the part of our brain that controls bodily processes automatically. So autonomic, automatic. And that would be things like digestion, circulation, and heart rate and blood pressure and heart rhythm, temperature regulation, sleep patterns, hormone production, our sleep control, all these different things that we don't consciously control. Now, the autonomic nervous system has two halves to it. This is very important. We have a parasympathetic half, which is the rest and digest. This is when things are copacetic and working like they should. Our blood pressure is 120/80. We eat a meal, we don't get bloated, we digest it, we absorb it. We have regular bowel movements, we sleep regularly, we have good temperature control, good circulation, good hormones. Then we have another half called the sympathetic or fight or flight part of our autonomic nervous system. Normally, this part of the autonomic nervous system is held in reserve. It's being inhibited until we are in a fight or flight situation, like we need to stay up all night to work on a project, or someone breaks into our home, or we're in a true fight or flight situation. So, but these two halves of the autonomic nervous system have to be in balance, like you see here on the seesaw. Now, many people that come to see me have autonomic dysfunction, or what we call dysautonomia. And what usually happens is their sympathetic or fight or flight part of their brain is overactive. It's engaged too much. And the parasympathetic isn't working very well at all. And this happens due to stress. But the stress isn't always emotional. It can be a chemical or physical stress. And so some of the symptoms of people who are sympathetic dominant is they don't sleep well, they have dry eyes, dry mouth, headaches, digestive problems, blood pressure problems, hormone imbalances, frequent urination, chronic pain, many of the symptoms that a lot of us have as we age. Now, one of the key symptoms of sympathetic dominance is poor digestive function. Now, how does this all tie in to yoga? Well, yoga actually activates the parasympathetic, the rest and digest portion of the brain. And so we recommend this to our patients once they're able to do it, to do this. And it's very powerful. Look, folks, sometimes getting better isn't a matter of taking a pill or changing your diet. It's sometimes a lifestyle change. And yoga is one of the best entry ways into exercise that we recommend to all of our patients. Now, how does yoga activate our rest and digest or parasympathetic function? Well, when we put our muscles in tension, when we put them in a position where we have to use them, which is what yoga does, we activate muscle receptors in these muscles, and these muscle receptors send signals up our spinal cord, and it lights up that area of the brain that controls our parasympathetic rest and digest centers of our brain. This is why yoga is becoming so popular, Because one of the things you'll hear is when people are done practicing yoga, they feel so relaxed, so calm. And who doesn't want that? But there are actual neurological changes that occur when you practice yoga. The second way that yoga activates the parasympathetic, the good part of our autonomic nervous system, is proper deep breathing along with the muscle tension that goes with the postures in yoga, activate the parasympathetic centers in our brain also. Most of us, when we're in a fight or flight or high sympathetic tone, we breathe too shallow. We don't breathe deep enough, and we don't blow off our carbon dioxide. When you couple the breathing, which is what yoga is all about, with the tension on your muscles, that really is a powerful parasympathetic activity. So this is why I recommend yoga to my patients. Now, I've been doing this for 30 years, and I'm going to tell you, not all yoga studios are created equal. I recommend Vibe Yoga, and you can go to vibeyogaroom.com. And the reason why is because they obviously, they have hired specific teachers that are excellent at what they do. And they specialize in the beginner for yoga. So someone who has no experience in yoga whatsoever can go there and get excellent teaching and start out at a level that's comfortable to them and work up. So I'm Dr. Ed Beyer. I hope that helps. Have a great day.